We have our attendees as well as our candidates on. So good afternoon, and thank you for joining us today. Today is our third of 3 webinars that we've been holding. Someone has a lot of noise in the background, so it's very hard to hear. So someone might be able to mute their phone until they're ready to talk. Thank you. So my name is Rhonda Stephen Carlson, and I'm the past president of the RNAO, and I'm the current chair of the Provincial Nominating Committee, and I'll be moderating this candidate's webinar. I just want to remind you that this is the third of 3 webinars, and all of them, including this one, are archived and will be archived on the RNAO, My RNAO site of RNAO's homepage, and they will be under the Elections tab. So if you want to review all 3 of the webinars or know of people, still have a lot of noise in the background. So, you'll be able to sort of see what other people have said or asked, and please encourage other members who haven't had a chance to be on the webinar to listen to that. Okay, so each of the candidates will have 5 minutes for some opening remarks, and once both of the candidates for each of the positions have spoken, we will open it up for questions, and we'll have a total of 10 minutes for questions for each of the positions. If you want to ask a question, you can either do it by asking it on the phone itself. Please state your name in advance so that we'll make sure that each person has a chance to ask questions. And if you prefer, you can also write in your questions in the chat box, which you will find the bottom right of your screen on the webinar screen itself. Candidates will have a minute to respond to any questions, and Sarah from Home Office, Sarah Penderbury, will give the 15-second reminder when there's 15 seconds left, and I will take the opportunity to ask people to stop if they go much over that 15 seconds. So we're going to begin with the MAL for practice. And just before I do that, I want to be able to let people know that the MAL administration, we had 2 candidates. Prior to our first webinar, one of our candidates had to withdraw her nomination, and so Rhonda Crocker-Ellicott has been acclaimed into the MAL administration position. So our MAL practice, our first candidate to speak will be Maria. Maria, are you able to speak for 5 minutes about your position?
Yes. Can you hear me okay?
Yes.
Yep. Okay, great. Thank you very much for giving me the opportunity and the time to be able to speak to the RNAO membership. My name is Maria Rugg, and I come to the RNAO with 26 plus years of membership with the RNAO, as well as in a variety of different areas of practice. I've posted a slide that just kind of represents the breadth and depth of my career, and I think for me the opportunity to be able to put my name forward for the nursing practice MAL is really an opportunity to be able to take all that I've learned about practice and in my experience in practice and in nursing practice, and take that passion and really work for the profession on a bigger scope. I would like to be able to look at the different areas of practice, and you can see in my slide that I've highlighted the work that nursing practice is doing right now at the RNAO, and I believe it's truly a shared vision that I have with the RNAO and the practice and the scope of practice that we're looking at. My career has spanned from birth, maternal child care, through to end of life and death across many settings, including hospital, community, public health, education, and research, both in the areas of practice as an RN, nurse practitioner, and clinical nurse specialist. And I truly believe that through these experiences with my fellow nursing colleagues across the province, I've been able to really uphold that that nursing practice vision of really the key to being to healthcare. I believe certainly that this opportunity to be on the board and to continue the tremendous work that RNAO has done in terms of shaping healthcare through nursing practice across the province is something that I hold very dear and near to my heart, and that my experience and practice experience and commitment to RNAO and nursing practice, and most of all to patients and the care that they receive, brings to the RNA board and the membership something that will help to further this scope of practice across the province. Ultimately, I have and hope to, if I am the successful candidate, to be able to continue the vision for nursing practice as the agenda has been set, but also focus on some very key issues that are affecting where we're at right now, in particular the safe injection sites, the professional accountabilities around physician-assisted death, and the NP compensation in primary care. I hope that that you will all take the opportunity to be part of the tremendous movement, and that you will consider voting for me to be also representing you in this tremendous movement that RNAO is embarking on and continues to embark on for nursing practice. Thank you.
Thank you very much, Maria. Cheryl, would you take your 5 minutes to present your position, please?
Thank you. Hopefully my voice stays good. Hi, I'm Cheryl Yost, and I live in Region 2, which is Perth County, the Southwest region, as well as Region 12 is where I do my work these days in rural remote, which is the Northwest, which is the true north of Ontario. What I see. I live on the west coast of Ontario, and I work in the northwest coast of Ontario. Working in rural remote, I really have found that I am well placed to continue to support the position of the MAL nursing practice. It really makes me excited, revitalizes me, and entices me not only for the lifelong learning, but for the advancement of our system and nursing role. I work and have worked in clinical settings of acute, coronary, emerge, and supported academic training, as well as worked in leadership roles and education. And I've also worked in primary care, and now as community health nurse and nurse in charge in the nursing station in the north. I'm bringing recent as well as past to build on, and much of it is in rural and remote, but opportunities in large settings in our region too as well. I worked in an 8-hospital, one site first of all, then there became an 8-hospital partnership, and then there was a change again, and I worked within a 5-site alliance. Following that, I also worked within a smaller site of 2, and then in a family health team, which was of 3 sites. I really enjoy working as a team, working with all of the players at the table, which is fantastic. As far as my obsession, what gets me excited and creates enthusiasm, it's really empowering others while having the resources that we need in order to do what we do best. As I said, I've worked within partnerships. I really enjoy partnership, collaboration, and reviewing new potentials. I enjoy reading the literature to see what changes are there and what potentially we could be looking at as well. Really, the service delivery model is my present passion, so we can build efficiencies and quality. Recently, I had mentioned this before, recently someone sent me an article on a the new future. looking at a one-stop shop model of care, no inpatient beds. This really had me thought-provoked, as well as those that I spoke with, and really what is possible. Anything's possible these days. And it can be a little unnerving, but it can also stimulate the excitement. And this is where I see RNAO coming in. It never ceases to amaze me, everything that happens within the RNAO umbrella. And within the Nursing Practice Committee, we have reviewed the ECHO report. We've reviewed the report that was done in 2015, coming together, moving forward, building the next chapter in rural, remote, and northern nursing. And this is one of the reasons that I stay in the system. Why do I want to continue speaking out for nursing and health? Well, you know what? Over the last couple of weeks, I've had a reality shock, and I've been ill myself. But I am on the mend, and I'm optimistic that, you know what, this is not going to happen again, and I need to put myself into a position that it does not happen. Is it because of the load people that are under today within the settings themselves? Is it the issues that nurses have been identifying that really has got caught up with me as well? Well, I'll leave that for the next thought and next discussion. But, you know, what will our health system look like? And we need the RNs and the NPs working to full scope, and we need a team. We need to stop fighting fires. We need an environment that is conducive to efficiency. We need nurses that are excited and not demoralized or bullied. The workplace is seen as increasing in speed, and not enough RNs and NPs in the setting for the needs. We need to stop the layoffs of RNs and NPs, and the ones that are also being replaced. The NPs have really surfaced, and the strength is there, and I am excited about what the opportunities are. Am I up to the task? Well, the system and the process must change. We must make sure that we do survive in this overall. We do have ideas. And as Tim Kersey has said in our last R&J, is that we need to speak up and stand out. And this is really important. And we as nurses haven't always taken that opportunity to do it. Often it's because, and from what I hear from nurses, that they are tired. And it's a case that at the end of the day, they just want to go home, and they also have other responsibilities. So really, the Nursing Practice Committee is one avenue and one part of the team. I have, within the committee itself, we've also worked very closely with the editorial committee. We've worked very closely
time, Cheryl.
And chapter presidents. Thank you.
Thank you very much, Cheryl. I'll open it now to our attendees at the webinar. Does anybody wish to pose a question on the phone? And if you do, please say your name first. Any questions? Sarah, did you receive any questions through the webinar?
We haven't received any yet. If you'd like to send in your question to me, you can just type it in the bottom right corner of your screen.
Okay. All right, and just to let you know that one of our candidates, Maria, will be leaving in a short little while, so if you have any questions for her and for Cheryl, please try to put them in as soon as possible. So can I ask you, if one question does come up for the MAL practice, please let me know before 2:30, okay? Okay, Sarah?
Oh, yes, okay.
Okay, thank you. Okay, we're going to move now to the MAL education position. Elizabeth, are you online?
I am.
Thank you very much. And I'm just going to ask if Tammy has been able to call in. Tammy, you're online? I'm not sure because I can't hear if she's online or not. Oh, the reason I asked Tammy was driving up north and was worried that she would not be able to, with some storm weather, get to the phone in time. So we'll start. This is the ML education position. Elizabeth, could you take your 5 minutes to present your position, please? And whoever has background, could you please put yourself on mute? Star 6 will put you on mute. Thank you very much. Okay, Elizabeth, if you could speak, take your 5 minutes, please.
Thanks, Rhonda. I'm sorry that Tammy may not be able to join us because it's always better when we have everybody sharing these opportunities, but she's certainly been good about posting her information appropriately. Thanks very much for the opportunity to participate in these webinars. I think they're a good way of reaching out to our membership in terms of seeking our votes and making sure that everybody knows that who the candidates are and getting people to exercise their one member, one vote. So since this is our last webinar, I really want to encourage people to take advantage of that one member, one vote. At the moment, I'm the member at large for education to the Board of Directors for RNAO. I appreciate the opportunity to serve the members of our organization and the organization by being on the board, and I'm asking for another mandate for at least the next year until we find out what changes there may be to our governance model. I'd like to continue as the member at large education. We were without a member at large for a while, and we were without a member education committee, which is the subcommittee of the board that I chair. We were without that committee for probably a bit over a year and a half, and in that time there were some substantial issues that arose with regards to nursing education. Nursing education does not exist in isolation in itself. Nursing education covers a very broad range of domains of practice. And just to let folks know sort of where I come from at the moment, I teach in the Brock University Loyalist College Collaborative Baccalaureate program at the Loyalist College site. I have taught at the University of Toronto in the undergraduate nursing program there at McMaster University as well. In addition to that, I've been a clinical educator at St. Joseph's Hospital in Hamilton and Sunnybrook Health Sciences Center in Toronto. So I think I'm well placed to understand the issues of both academic education and how they impact on clinical education and the unique perspectives of being a clinical educator as well. So I'm very respectful of both of those domains of education. The Nursing Education Committee represents both of those domains of education quite fairly and effectively, I think. And given the last year, we've had 4 meetings already since last August, and we're coming up for our 5th and final meeting for this year, this board year in May. And some of the issues that we've tackled have very strong implications for both education in an academic environment and clinical practice. The one that we've spent a lot of time monitoring, obviously, is the NCLEX exam, the difficulties that have been encountered with our graduates writing that, but not only just the challenges of a new computer-assisted exam, which has created some angst, I think, and some questions about how we want to assess our new graduates and have them ready for practice. But there have also been issues around that in terms of the economics of what happens when people are not able to be successful on the first or second go-around or even the third one with regards to that exam. So it's been good that we have that representation from both practice and academia to look at some of those issues. We want our grads to be well prepared, and we need to look at what that means in terms of our academic requirements, but we also need to look at the consequences to clinical agencies who have used new grad initiatives, invested in new grads in terms of preceptorships and orientation, and then the loss of that person when they immediately lose their registration, temporary registration, and can't work. So we have looked at that very intensely, and we continue to monitor that and make some recommendations to Home Office about where we think we can have some impact. In addition to that, we have some other initiatives that the Member Education Committee has looked at, has begun to work on, with the hope that we'll, I would really like the opportunity to continue with these initiatives so that when we hand them off to Home Office, they come with really solid recommendations and guidelines for moving some of these issues forward. So one thing that we're worried about, obviously, is RN replacement in terms of how it impacts things like clinical placements for our undergraduate students, who are their role models when they go in for clinical placement opportunities, and in terms of preceptorships for our pre-grad placements, particularly in some of the smaller, the rural areas. I come from a fairly rural, community-based environment as opposed to a larger teaching facility, and we're facing a large problem with having pre-grads find adequate preceptorships for them because so much has happened in terms of RN replacement here. So that's another issue that we're worried about. We're monitoring and making recommendations about nursing education for people in the clinical environment. Very few nurses can afford to spend $1,000 to go to a conference, and yet we also know that in clinical agencies, frequently the folks who are cut the first in a budget go-around are education departments, and yet the average working nurse really relies on a clinical educator for support, updating, monitoring new equipment, interpreting research, all of those things that a nurse needs in order to go to work in a day, but necessarily because of providing, you know, patient care, may not be able to take the time to collect all of that information. So,
time?
Yep. Okay, well, in that case, I would really, really like an opportunity to serve again for the next go-around, and I would like an opportunity to finish those things we've been working on. Thanks very much.
Thank you very much, Elizabeth. Tammy, are you on? I don't know if she is. I'm going to open it up. Are there any questions for Elizabeth or for MAL practice and candidates? Sarah, have you received any online?
No, we haven't.
Okay. So what I will do is I will again remind our listeners, our attendees, that this webinar and the two previous ones will be archived on my RNAO, and you can find a link to them on the elections page. And so that you have a chance to listen to all three of the webinars and the information that people shared. Remember again, I think both Elizabeth and Cheryl may have alluded to this, is that it is important that all of our members vote. And one member, one vote will open on Tuesday, the 19th of April at noon, and will end on Thursday, May the 5th, also at noon. There are quite a number of things on the selections ballot in addition to the MAL positions. And so please vote, and please remind your nursing colleagues to vote as well. So we'll ask one more time if there are any questions. So hearing none, I will thank you very much for your time and your attendance, and thank our candidates again for their time and their presentations. And I hope to see many of you, if not all of you, at the AGM. Thank you very much.
Thanks,
Bye-bye.
Rhonda.
Bye.
Bye.